A Canadian suffers a heart attack every 7 minutes. Many of these people die because they don't get treatment quick enough. Health specialist, marble mouth this morning, Leah Sarich joining us now. How to recognize the symptoms of a heart attack and understanding the risks, of course.
Yeah, those are the two things you can do to really make sure you know what's happening if you're having a heart attack, so you can get that treatment as fast as possible. That's what you need to know. The other thing most of us don't realize is that heart attacks affect men and women equally.
Really?
Equally.
You never hear about it in
women. You never
women.
hear that, no.
Yeah.
And in fact, doctors still will think, oh, well, I don't know if this is actually a heart attack. It's a woman. It could absolutely be a heart attack if it is a female. So it goes right across the board for men and women. So a heart attack is basically when you have an interruption of blood flow to the heart muscle, usually due to some kind of blockage. And so the thing that matters here is getting rid of that blockage so you can restore the blood flow to the heart. And this is why it's so important to understand the symptoms of a heart attack.
Not all patients present with the typical symptoms of severe chest pain or heaviness in the chest or jaw ache, and they get sweaty, they get palpitation, they don't feel very well. Some patients just have a little of stomach upset, or they feel they have stomach upset. Some people have arm pain, and it depends. So the elderly generally don't have the typical symptoms. Women sometimes don't have the typical symptoms. Diabetics don't have the typical symptoms. So it can vary.
Sounds mysterious.
It can be a little mysterious.
Yeah.
So the symptoms do vary, but the main symptom that generally everybody's going to have is that chest pain.
The heaviness, right? Yeah.
So now the symptoms can be a bit vague, but what we do know are the risk factors. So we should talk about those, because you know then if you are at risk of having a heart attack and you have some of these symptoms, that could be a heart attack. So let's talk about those risk factors. Number one, family history of heart disease. That's the big one. High blood pressure, high cholesterol, diabetes, and smoking. So those are your risk factors. So
those are the big five.
Those are the big five. So if you have any of those are the things you want to work to reduce your risk of a heart attack. So that's the one thing to think of. And then, as I've said this before on this show, if you are, however, going to have a heart attack, Calgary is the place to do it. We have the lowest mortality rate, so that means the fewest number of deaths from heart attack in the entire country. Here in Calgary. Yeah, so if you're going to do it, this is the place to do it. And it goes back to that same principle, which is people here are getting the treatment they need faster.
We have a great program in the city of Calgary, in fact in the province of Alberta, where patients arrive immediately. They're taken directly to a place where we can open the artery either mechanically with an angioplasty or given a medication to open the artery. It's basically a blood thinner or a blood clot buster, we call it. And that leads to less damage to the heart muscle and hopefully improved long-term survival and outcomes. So the muscle is not damaged to the same extent, and all the other down effects that happen as a result are reduced.
Exactly what you want. Exactly. So the main thing that's going on here is that the ambulances here in Calgary and the paramedics, they have a little bit of extra training, and they're also aware of these heart attack symptoms. And not to mention the fact that they can also do an electrocardiogram right in the ambulance.
Oh, like in the vehicle?
In the vehicle.
Oh.
So that information from the electrocardiogram they can then read it and go, gee, you know, I think this is a heart attack, and then they can administer that medication that Dr. Trabulsi was talking about. So to get that medication as quickly as possible. They will also get them to the hospital quicker, and then the doctors will be waiting there. So the cardiac team will be waiting for them because the information from that electrocardiogram has gone to the hospital.
Wow.
So they know, hey, we've got a heart attack patient coming in, and it's just like you see on Grey's Anatomy and ER, like they're standing outside, they're waiting, and so you're right in.
You're
so
like 4 steps ahead.
That's right.
Because of all that info, right?
That's right. So it's the care pathway that we're talking about that makes a big difference here in Calgary. But of course, what we want to do is prevent that heart attack in the first place. So reminding everyone to know your risk factors, try to reduce those risk factors, and then as we always say, if you can have a healthy lifestyle, that's what you want to do. So you're eating healthy and you're losing weight. Those are the big things you can do to reduce your risk.
There you go. breakfasttelevision.ca. That's where Leah's blog is. You'll find out all this information there. Good stuff. Thanks, Leah.
You're welcome.
The man with